Hello everyone and welcome to my channel Body Mind Healing. My name is Maria Sanchez. I am a holistic health consultant, a family nurse practitioner, a psychiatric mental health nurse practitioner, and a doctor in nursing practice. The case for today is, what is the difference between ADHD and anxiety? Attention deficit hyperactivity disorder or ADHD and anxiety disorders are two of the most commonly diagnosed mental health conditions, especially in children and adolescents, but they also significantly affect adults. While they can share overlapping symptoms such as restlessness, difficulty concentrating, and irritability, they are distinct conditions with different causes, mechanisms, and treatments. Understanding the differences between ADHD and anxiety is essential for proper diagnosis and treatment. Let us define both disorders and present some core features. ADHD is a neurodevelopmental disorder characterized by persistent patterns of inattention, hyperactivity, and impulsivity that interfere with functioning or development. It typically appears in childhood before age 12 and may continue into adulthood. There are three main types of ADHD: predominantly inattentive type, predominantly hyperactive impulsive type, and combined type. Anxiety disorder, on the other hand, involve excessive fear or worry that is difficult to control and interferes with daily life. Anxiety can present in various forms such as generalized anxiety disorder, social anxiety disorder, panic disorder, and specific phobias. While anxiety can emerge in childhood, it often becomes more noticeable during adolescence or adulthood. Now let's look into their symptoms and presentation. Though some symptoms may appear similar, there are key differences in their origins and expressions. Inattention in ADHD is typically due to distractibility, a brain that seeks stimulation and difficulty maintaining focus on non-preferred tasks. People might start tasks but fail to complete them, frequently lose things, or struggle to follow through with instructions. Inattention in anxiety, however, is usually driven by preoccupation with worry. People are mentally consumed by anxious thoughts, making it hard to concentrate on what is happening around them. The inattention is not due to boredom or stimulation seeking, but rather excessive rumination or fear. Restlessness in ADHD is more physical and constant. It is part of the hyperactive component. People might fidget, tap, or feel like they are driven by a motor. Restlessness in anxiety is more mental and emotional. People might feel tense, on edge, or have trouble relaxing due to worrying thoughts, but not necessarily exhibit outward hyperactivity. Impulsivity is a hallmark of ADHD, but is not typically present in anxiety. Those with ADHD may interrupt others, make hasty decisions, or struggle with self-control. In contrast, people with anxiety often overthink and avoid making decisions for fear of negative outcomes. Does ADHD and/or anxiety have cognitive or emotional impacts in our lives? Yes, indeed. ADHD often leads to academic, occupational, and social difficulties due to challenges with organization, time management, and task completion. Emotional regulation can also be a challenge, leading to quick shifts in mood or frustration. People with ADHD may struggle with self-esteem due to repeated failures or criticism. In contrast, anxiety primarily affects emotional well-being through persistent worry and fear. This can lead to avoidance behaviors, perfectionism, and excessive reassurance seeking. Over time, anxiety can result in physical symptoms such as headaches, stomach aches, muscle tension, sweating, palpitations, fatigue, etc. How do we diagnose these disorders? Diagnosis of both conditions involves a thorough clinical examination, often including interviews, questionnaires, and behavioral assessments. A key component of diagnosing ADHD is evidence that symptoms were present before the age of 12 and occurred in multiple settings, for example, school, home, work. For anxiety, a key is to look for persistent and excessive worry that is hard to control and not better explained by another mental health disorder. It is also possible for someone to have both ADHD and anxiety. In fact, studies suggest that around 25% to 40% of people with ADHD also experience an anxiety disorder. When both conditions coexist, the symptoms can interact and complicate the clinical picture, making accurate diagnosis and treatment planning more complex. What about treatment approaches? ADHD treatment, as mentioned in a previous video, often includes a combination of behavioral therapy, psychoeducation, and medication. Most commonly stimulant medications like methylphenidate or amphetamines, which help improve focus and reduce hyperactivity. There are several other medications used to treat ADHD, such as non-stimulants, Strattera and Qelbree, alpha-2 adrenergic agonists, some antidepressants high in norepinephrine and dopamine, etc. Anxiety treatment, as also mentioned in a previous video, typically involves psychotherapy, such as cognitive behavioral therapy, dialectical behavioral therapy, exposure therapy, acceptance and commitment therapy, relaxation techniques, etc. Sometimes medications are used, including selective serotonin reuptake inhibitors or SSRIs, serotonin norepinephrine reuptake inhibitors or SNRIs, tricyclic antidepressants, monoamine oxidase inhibitors, benzodiazepines, buspirone, beta blockers, gabapentin, antihistamines, mood stabilizers, antipsychotics, etc. For people with both conditions, treatment might need to be carefully balanced. As a general rule, mood disorders are addressed before ADHD, but there are always exceptions. People are treated on an individual basis, although algorithms are often useful. Having said this, sometimes treating anxiety first can help people better engage in behavioral interventions for ADHD. In other cases, managing ADHD symptoms may reduce the stress that contributes to anxiety. Let us point out key differences between ADHD and anxiety. The main symptoms in ADHD usually are inattention, hyperactivity, impulsivity. In anxiety are usually excessive worry, fear, and avoidance. The onset in ADHD typically before age 12, and in anxiety can emerge at any age. The focus issues in ADHD are due to distractibility, and in anxiety are due to racing or intrusive thoughts. The physical signs in ADHD are fidgeting, moving constantly, and in anxiety, muscle tension, fatigue, stomachache, sweating, palpitations, etc. The mood in ADHD is usually frustration, irritability, mood swings, and anxiety is usually nervousness, worry, feeling overwhelmed. The treatment in ADHD is usually stimulants and behavioral therapy, and in anxiety it's usually therapy, including CBT, SSRIs, SNRIs, and relaxation techniques. In summary, while ADHD and anxiety may look similar on the surface, particularly regarding concentration and restlessness, they stem from different underlying mechanisms and require different treatment approaches. Recognizing these distinctions is crucial for effective care. A mental health professional can conduct a comprehensive evaluation to differentiate between the two and guide the most appropriate path forward. May the inner peace that we cultivate today expand and guide us always. Until next time.